Antonio has a secret. 3 years ago, he was diagnosed with HIV. He says he can't tell his friends about his illness. The discrimination he would face keeps him silent.
It's
difficult to live in a place like this. If people hear you have HIV or AIDS, they are afraid of you.
This clinic, funded by international donors, is one of only 3 AIDS clinics in all of Western Guatemala. Antonio is alive today because of the treatment he receives here, half an hour from his hometown of Almalonga. Almalonga is often called the miracle town. The evangelical church arrived 3 decades ago, promising eternal salvation. 90% of the residents have since joined the church, making this town unique in this devoutly Catholic country. But health workers worry that the church's influence is making it difficult to combat the spread of HIV.
That evangelical preachers need to reflect on the reality in these indigenous communities. They are the leaders, and condemning the use of condoms and increasing discrimination doesn't help the people.
In the first few months of 2009, 14 new cases of HIV were reported in this town of only 15,000. Angel SOLVAL's research suggests that the actual level might be 3 times as high. Lack of education and adequate medical facilities in towns like this mean many cases of HIV go unreported. Many healthcare workers say that unless things change, there will be an AIDS crisis in Guatemala. Antonio XICARA is one of the few evangelical preachers in favor of a sex education campaign proposed by Almalonga's mayor. But he also believes there's an important role for the church to play in helping stop the rise of HIV transmission.
We're telling the people to be faithful in their marriage so they don't get infected. However, I also think the church needs to rise up, to go beyond prevention and find a way of curing people through prayer and the love of God.
Back at the clinic, Antonio is wrapping up his visit, grateful for the assistance. His town is simply too poor to buy the necessary medicine or pay for specialist doctors, and this worries him.
People need to open their eyes and their hearts. We have to protect our indigenous people from this illness before it's too late.
David Mercer, Jazeera, Almalonga, Guatemala.